I think it's so easy for us to say, I don't think it's as painful as they think it is. Well, we're not perceiving pain. I mean, I also remember I had a very young, not all that young, probably 28-year-old professional footballer who had been playing for the club in the Premier League, sort of higher level, with a knee problem. And he'd got, from an MRI perspective, he'd got a torn lateral meniscus, but it was one of those that I was able to play with, lacked a little bit of end range flexion, occasionally got a little effusion, occasionally was a little bit stiff into extension. And I remember once he just, after one game, he just said, right, I can't carry on anymore. And I remember looking at his knee a day or 2 days later, and there was no real difference in what he'd been presenting with over the last two or 3 weeks. But he decided he just couldn't play anymore. The manager just said to me, well, just because he's got no more change in the symptoms, is he making the most of his symptoms? And I went, well, there's two ways of looking at it. Maybe he was underplaying them before. But the one thing I can't tell you is what he's feeling. And also what we're not aware of. We've just talked purely clinically. This was a player who in 3 months' time his contract was up, who basically knew that if he ended up needing surgery, he may not get a contract renewed and another club might not want him. Was he starting to protect himself slightly? Was he fearful? And probably a lot of things were going on that were influencing how that knee felt. Nothing to do with playing football on that field, but just the context of where he was in his career. And I think a good physiotherapist or a good caring practitioner will have an understanding, but never be able to turn around, particularly to a third party, and say, it's not really changed, he must be making the most of his symptoms, because that's not the case. Very dangerous language to sort of get involved in, particularly in professional sport, where sometimes there are conflicts, but it's again, it's a person. There's an emotional brain attached to that knee that is probably looking forward and thinking, can I, can't I, should I, will I, should I not? What's the risk? And they have to calculate it from their personal angle and not just the team angle, because irrespective of how well the team do, they might not do well. And you're stuck in the middle of all of that. I think, again, so let's play this case out, because this is a real case. It's easy to talk about. This player I'd known for 3 years. And when you're dealing in a club environment and it's a professional environment, you know these people day to day. So you get to know them as people. And I think that's the key bit. They're people first, player second. And knowing this player's background and where he was from, living in England, thousands of miles away from home, I felt the best way to try and understand him was to send him a text message just to check he was okay and ask him, would he fancy meeting me at 5 o'clock following day for a coffee in a coffee bar and just have a chat. And again, you could argue that's more difficult with just outpatients, but in this case we met, and I think, first of all, seeing him in his normal clothes, seeing me in my normal clothes, out of uniform, and most importantly, just asking the question, how are you? I'm not asking about your knee. How are you? Let's forget your knee. And again, that when this person opened up all about his contract, all about his worries, all about that. And what you forget is this is a young, 28-year-old person who's, yes, living and playing in a good brand of football in England, so financially earning a good salary, but that salary could end in 3 months with nothing. He's also supporting a mum and dad back home, thousands of miles away, who he's bought their house, paying for their house, looking after his sister. The pressures are immense on such a young person's shoulder. And I think, this person, did he need psychological help? No, he didn't. This is someone who just needed a caring, compassionate person to listen and help him work out, yes, you could stop now and possibly have surgery. B, one could carry on playing and then possibly face surgery. C, might never need surgery, but these are the possible options and these are the things we should be concerned about if it changes. And I think gave him that rationale within this was in the space of a week. So when he stopped playing and said, I can't carry on playing, it was like on Monday after a Sunday game. We had a game the following Saturday. He was available to play again and played to the end of the season, and actually eventually never did have surgery, and actually did get another, didn't actually stay with his club, but got another contract with another club. You know, so, but it I think again, we forget, most importantly, you know, I've often said it, patient, yes, without shadow of doubt, but person first. And yes, we have to respect confidentiality. So we're going to treat them as patients, but they're a person. So let's, you know, genuinely, how are you and how is this affecting you, and affecting you in what way?